So there are medical conditions that can predispose you to gaining weight. One of them very naturally would be pregnancy, as you described. And I would imagine that each time it gets a little bit more difficult. As we see as we get older, it gets a little more difficult to lose weight. And we'll talk about that in a couple of minutes as well. Are there other hormone conditions? I mean, is hypothyroidism associated with it as well?
That's a very commonly asked question. And yes, a sluggish or a low thyroid can predispose to some weight gain. But there's been numerous studies that have shown that it really is not the main factor. So that the people have tried to place overweight and obese patients strictly on thyroid, even if their thyroid function was normal, and there really was no weight loss. So that's been well documented. The issue of a slow metabolism, there's a myth going around about overweight people having a slow metabolism. Actually, overweight people often have a higher metabolism than a lighter person, because your metabolism is dependent upon your muscle mass. So if you're overweight, naturally your muscles tend to be a little bit more developed, and your muscles are essentially your metabolism. They burn the calories that you experience every day. So many obese patients, overweight and obese patients, have high metabolism. The problem is they're exceeding their high metabolism with food intake. And that's really what it always is. It always is an imbalance between the metabolism of the person and the intake of the person. So it's still more about more in than more expended.
Well, so